Tonight, I'm really delighted to introduce two speakers. And they approached us to give this talk, which is really exciting because both of them are senior neurology trainees. So they're going to be neurologists in a few years. So the first one who's going to speak is Laura, right? So Laura Wilson graduated from McGill University in anatomy and cell biology. And then she went to medical school at the University of Alberta, and we were lucky to have her come to British Columbia, and she's in the adult neurology program. She's a chief resident, so she's in her 4th year. So she's going to talk a bit about the symptoms of stroke and how to diagnose a stroke and treat a stroke. And then she'll be followed by Christine Stables, who graduated from Simon Fraser University in biological science. And she went to medical school at University of British Columbia. And she's currently a 3rd-year adult neurology resident. And she's going to talk about how do you prevent a stroke, which is very important for all of us. And we'll start with Laura first. And I'd just like to remind you that Money will be handing out little pieces of paper and pens and pencils so that you can write down your questions. Because this is being videotaped, and sometimes it's hard to hear people when they ask questions, we ask that you write your questions as clearly as you can. So I don't have to try to interpret them and ask a different question. And then our experts here will respond. We have a celebrity sighting. We have Dr. Dean Johnston in the front. And he's one of our staff neurologists here at Providence Healthcare. And he actually gave one of our first talks of this series back in 2009. So really happy that he could come. It was that long ago, yes. So we'll start with Laura. Thank you very much.
Thanks, Dr. Palapoo, for the introduction. So as mentioned, Christine and I are both neurology residents, and we felt that it was important to come and talk to you today about stroke because this is a very common condition that we see as residents. We see it on almost a daily basis. And so we thought it would be important for us to explain to you the symptoms of stroke, how common stroke really is, how we can treat it, and probably the more important aspect, how to prevent them. So let's begin talking about stroke. So in developing this talk, we came up with a list of questions, things that we'd hope to answer over the next 30 or 40 minutes. And hopefully by the end of this talk, you'll be able to answer some of these questions on your own. So some of these questions include, why is knowing about stroke important? What exactly is a stroke and what are the symptoms? What should I do if I or someone I love is having a stroke? Is there treatment for stroke? And then how can I prevent a stroke? As I already mentioned, stroke is a very common condition. All of these famous faces on the slide here have been afflicted by stroke at some point in their lives. One of the more famous ones of recent memory in the top part of the slide is Dick Clark, who became kind of a poster boy for stroke in the later few years of his life. He was a very famous television and TV personality. But after his stroke, he continued to be involved in the entertainment field despite being significantly disabled in terms of his speech and language. So that was important to recognize how disabling a stroke can be. But beyond famous people, of course, many people in our own community are affected by stroke. And here we have some hard numbers to remember in terms of stroke in Canada. It is the 3rd leading cause of death in Canada. And each year, more than 14,000 Canadians will die from a stroke. And in fact, of those Canadians, more women than men in fact die from a stroke, which is in contrast to what many people believe, that more men are in fact affected by heart disease and stroke than women. In fact, it's the reverse. Over 50,000 strokes occur in Canada every year. And if you calculate that out, that works out to about 1 stroke every 10 minutes. And so as I mentioned, in neurology, it's very common for us to see strokes, and we recognize them on a daily basis. But beyond the mortality of stroke and beyond that death rate, about 300,000 Canadians are living with the effects of a stroke every day. And so beyond mortality, disability is a very important factor of stroke. This is affecting people's ability to drive, their ability to work, and also their ability to just perform tasks in a daily basis at home. And so disability is probably the most important thing we want to prevent when we're thinking about stroke. And beyond these hard numbers, one important thing that we want to get across with this talk is that strokes can be treated, and many strokes can be prevented. And so these are 2 key points to take away from this talk. So what exactly is a stroke? At its basic definition, a stroke is an injury to the brain from a lack of blood supply. This results in a sudden loss of brain function. This can happen because of one of two things. It may happen because an artery or blood vessel supplying a part of the brain becomes cut off or clogged, either by a narrowing of a blood vessel or from a blood clot. Another way that a stroke can happen is from bleeding into the brain. This type of stroke is known as a hemorrhagic stroke, and I'll mention a little bit about this in a few slides. The other type of stroke, where the artery becomes cut off or clogged, is known as an ischemic stroke. Another way to remember stroke, beyond the definitions I just gave, is that a stroke is a brain attack. Just as the term heart attack is used in cardiology, denoting an area of heart tissue that is being cut off or dying, a stroke is a similar phenomenon and can be thought of as a brain attack. There are many other terms relating to stroke that you might hear, including cerebrovascular accident, though in neurology we tend to shy away from this term because accident doesn't really encompass what is happening in the brain. It's not truly an accident. Other terms you may hear are transient ischemic attack or mini stroke. These are the same idea as an ischemic stroke. However, in the TIA or mini stroke, the symptoms are often reversible and only lasting for minutes to hours. But these are important to recognize because they could be the warning sign of a much larger stroke to come. And so that's why we want to recognize a mini stroke or a TIA early. Some other terms you may hear may include lacunar or lacunar stroke, which just denotes a small volume stroke, often related to smaller blood vessels within the deep portions of the brain. Two types of hemorrhagic strokes, and terms you may hear related to these, include intracerebral hemorrhage, which denotes a large area of bleeding, usually within the deep parts of the brain, and subarachnoid hemorrhage, which is bleeding into the covering surrounding the brain, often causing a very large headache, but symptoms of a stroke as well. So what in fact causes a stroke? How do we lead to this sudden loss of brain function and dying back of some of the brain? One of the more common ways that we see a stroke develop is related to blood clots forming in the vessels of the neck and traveling to the brain. So here we have a picture of the carotid artery, which is a large vessel that sits in the neck and goes on to supply the brain with blood. At some point in the neck, the carotid artery divides into external and internal segments. The internal carotid artery goes on to supply a very large portion of the brain. With some risk factors, including hypertension, smoking, as well as some dietary factors, plaque or cholesterol deposits can develop in the neck, in this artery. And if that develops, blood clots can form and travel to the brain. If a blood clot forms here and travels to the brain, it causes symptoms of a stroke. And so this is an important factor when we're thinking about what causes a stroke. Beyond thinking about the carotid arteries, blood clots can also form within the heart and travel to the brain, causing the symptoms of a stroke. But why would this happen? So a common condition, and some of you may have heard of this, is atrial fibrillation. Atrial fibrillation is an irregular beating of the heart, which leads the heart to very prone to forming blood clots. If a blood clot forms within the heart, it can be pumped off up the carotid artery and into the brain, causing the symptoms of a stroke. And so this is a very common condition we see and one that we want to use treatments for to prevent strokes. Another reason a blood clot may form in the heart would be after a heart attack or with heart disease related to the valves of the heart. There are other reasons why a blood clot may form in the heart and travel to the brain, but I didn't go into much more detail than that. As I already mentioned, other strokes are caused from bleeding into the brain. This can be caused by a number of different mechanisms, but one common one is related to aneurysms. An aneurysm is an outpouching of a blood vessel, an irregularity of a blood vessel, which over time becomes prone to rupturing and bleeding. And this may cause similar symptoms of a stroke. Another way that you may have bleeding into the brain, however, is related to many years of high blood pressure, which damages small blood vessels within the brain, which become prone to rupturing and causing swelling within the brain and damage to that area of brain. So here again, we just have a summary looking at the main types of stroke. On the left, we have the hemorrhagic or bleeding type of stroke, where blood leaks out of an artery wall, which is damaged, causes swelling in that area of brain, and damages that area of brain. On the left side, on the right side, we have the ischemic type of stroke, which may occur because of narrowing of a blood vessel, either within the neck in the carotid arteries or within the small blood vessels within the brain, and those areas can form blood clots. A blood clot may also travel from the heart, as I previously mentioned, to block off one of these small arteries within the brain, causing a stroke. So what are the symptoms of a stroke? Although I described a blood clot or bleeding into the brain as causing a stroke, what are the symptoms that you're going to recognize? So as opposed to other organs of the body, the brain is interesting in that a variety of different symptoms arise depending on which part of the brain is affected. And so as I say here, the symptoms of the stroke depend on which part of the brain is injured or dying due to lack of blood supply or bleeding. And here we have a nice picture of the brain. And so there are many different types of symptoms that come up with stroke, but here I've listed some of the main ones and some that you may recognize. So first of all, problems with speech and language become very important with stroke. This can range from having some slurred speech to having a totally abnormal language and making the words sound totally bizarre, and this can develop all of a sudden. This commonly occurs if the left side of the brain is affected, because this is where the speech and language area is primarily located. Many people would recognize that weakness on one side of the body can develop after a stroke, and that leaves quite a number of people with some disability. That occurs if the motor area is affected on one side of the brain with respect to a stroke. Numbness is another thing that may occur on one side of the body or the other. Vision loss can also occur in one or both eyes, and this can occur whether a blood clot travels to the eye itself or to the back part of the brain, which is responsible for vision. One thing to keep in mind about these symptoms is that they occur suddenly. They occur over seconds because the brain does not like being cut off from its blood supply for very long. It can't tolerate that. And so these symptoms do not occur over hours or days. They occur all of a sudden. In terms of speech and language, someone could be talking to you in mid-sentence totally normally, and then their speech goes totally wonky, slurred, you can't understand them. Someone could be walking down the street, they collapse with weakness on one side. It happens that suddenly, and so it's important to recognize that. In addition, there's often no pain with a stroke, and people find this a little bit hard to believe because they can be so devastating. Aside from having some headache, especially with the bleeding type of strokes into the brain, there isn't much pain. So even if you're unable to move your entire right side of your body, the arm or leg is not going to hurt. You may have some mild headache, but aside from that, there's often no pain. So although I mentioned some other symptoms, these are the key symptoms and signs to recognize with a stroke. And you can remember it by the mnemonic FAST. F stands for face, and so often with a stroke, the face and smile become uneven or asymmetric. And so you may recognize people have a droopy face on one side, or their smile becomes uneven. A stands for arm. And so the arm may become weak on one side of the body, and often on the same side as the face becoming weak. And so one good thing and one good test you can do is just have the person lift both arms up and see if they can hold their arms up. If one arm drops down, you may be dealing with a stroke. S stands for speech. And so as I already mentioned, the speech can become quite strange, especially if a stroke is affecting the left side of the brain. It may become slurred, but it also may become just very strange and odd in character. And I'll actually show you a video of this type of speech in a little bit. And then T stands for time to call 911. If any of these symptoms are recognized and they develop suddenly, and this is a big change, 911 should be called, because as we'll see, the time to treat stroke is actually a very short window. And so we need to recognize the symptoms quickly so that we can get onto the treatment. And so just to emphasize this FAST video, actually a med student that I was working with that was visiting from Australia told me about this ad campaign that they played in Australia. I think they also played it in the UK. But I thought it was a good one to actually show what some of the symptoms of stroke may look like.
When a stroke strikes, It spreads like a fire in the brain. The longer it goes undetected, the more damage is done. To spot the signs of a stroke, you have to think and act fast. F. Face. Has their face fallen on one side? Can they smile? A. Arms. Can they raise both arms and keep them there? S. Speech. Is their speech slurred? T. Time. Just like a fire, it's time to call 999 if you see any single one of these signs. The faster you act, the more of the person you save.
Okay. Okay, so that just gave you a sense of, what it may look like if the face is dropping on one side and you saw that her arm dropped down to one side and she was not able to lift it. But what about the speech disturbance? That's the S part of the fast mnemonic. I'll just show you this video. So this is of a young woman who actually was presenting, I think she was doing some kind of newscast for the Grammys. I'm not sure if she ended up having a stroke or did she have a migraine. It doesn't really matter what her diagnosis is, but it's just a good example of how disturbed your speech can become with a stroke. And so this is the type of speech that you want to consider. And it also, it can occur, I'll just say this before we see this, it can occur without the presence of weakness, and that's in her case. So let's just take a listen to how abnormal this speech is.
CBS 2's Serene Branson is live at the Staples Center with highlights and backstage coverage we're seeing for the very first time. Serene.
Well, a very, very heavy debatation tonight. We had a very Darrison, but let's go to Terrace and look for the head of the pit.
Okay, and so that was an example of, you can't understand anything that she's saying, and that's something that you may see with a stroke, that the speech becomes that abnormal, even in the absence of any weakness. And so, just recognizing that abnormal speech can represent a stroke is important. And so why do we want to act fast? Why do we want to recognize these symptoms quickly? Well, for every 1 minute delay in treatment, almost 2 million brain cells are lost. And so obviously that sounds quite significant. But also we want to act fast because there is treatment available for acute ischemic strokes, but only in the first 4.5 hours after a stroke begins. And this medication is known as intravenous tissue plasminogen activator, or we simply refer to it as TPA. TPA is a clot-busting medication. And so as I described before, some types of strokes develop from a small blood clot that travels to the brain. If we could open up that blood clot and restore the blood supply to the brain, that would be a good thing. And so that's exactly what this medication does. The goal is to restore blood flow and to improve the symptoms of the stroke, whether that be speech disturbance or weakness. But again, this is only approved for treatment of ischemic stroke, so not the bleeding type of stroke, and it's only within the first 4.5 hours after symptom onset. And so that's why it's very important to call 911 if any of these symptoms are recognized, so that the patient can be assessed quickly and seen by a neurologist and treated with this medication. And again, the benefit of this medication, although approved for stroke and can hopefully restore the blood flow, over time the benefit decreases, and so the earlier the better with this medication. There are some other potential treatments for stroke, and you may have heard about some of these or know some people that have had these types of treatments. One of them is intra-arterial TPA. So this is the same medication I just described. It's a clot-busting medication. However, it needs to be given by a neuroradiologist or a neurosurgeon, where it's given through a catheter directly into the brain, directly into the clot. However, this is not as widely proven as the intravenous form that we usually give. Mechanical thrombectomy is another type of procedure that can treat stroke. Again, it's not widely available and it's not a proven therapy, but this is again done by neuroradiologists or a neurosurgeon, where they go directly into the brain and hopefully to remove the clot and restore blood flow. Another treatment some people may have heard of is a carotid endarterectomy. This is a surgery on the carotid arteries, which is often performed days or weeks after a small stroke or a mini stroke, which is performed on the carotid arteries in the neck to hopefully relieve some of the blockage and to prevent a larger stroke from happening in the future. And so that's it for my part. So we're going to switch gears and talk about stroke prevention. So I'm just going to turn it over to Christine. And so we'll just answer any questions towards the end if you want to write them in.
Thanks. Okay, so now we're going to talk a little bit about preventing stroke and prevention in terms of secondary stroke prevention for people who have had a stroke already, as well as some of the things that you can think about in terms of lifestyle factors and management, even if you haven't had a stroke before. So when we talk about prevention, we know there are lots of things that put us at risk for having stroke, and some of these risk factors are things that we can't change. Those things include age, gender, family history, and ethnicity. However, there are lots of factors that we can modify to try to improve our risk from developing stroke. One of these things Laura mentioned previously was atrial fibrillation. So I'm now just going to talk about that in a little bit more detail. As Laura mentioned, atrial fibrillation is an abnormal or irregular rhythm of the heart. We have a picture of the heart here, and you can see at the top of the heart there are two chambers that are smaller than the bottom two chambers. The top two chambers are called the atria, and the bottom two chambers are the ventricles. In this picture here, you can see some arrows which show the blood being flown in turbulent directions. And this is what happens when you have an irregular beating of the heart in atrial fibrillation, because what normally happens is you get contraction of the top ventricles that push blood into the top atria that push blood into the ventricles, and then the ventricles then push blood out into the body. In atrial fibrillation, you get basically just fibrillating of those atria, so they're not contracting in a coordinated manner, and they're not contracting with their signals being sent down to the ventricles. So you get this sort of fibrillating pattern. The blood can become turbulent and can start to form clots on itself while it's sitting in those atria. These clots can then get propagated down into the ventricles and out through the big blood vessels to the brain and cause a stroke. So we know that atrial fibrillation triples the risk of stroke and is one of the biggest risk factors that we can treat for preventing stroke. So what are some of the causes of atrial fibrillation? Well, there are many, and it is something that often needs to be picked up by your doctor. It's something that often people aren't aware that they have. Some of the causes of it can be high blood pressure, an abnormal structure of your heart, a previous infection or inflammation, any disease that has damaged the valves of the heart, an overactive thyroid, blood clots in the lung, congenital heart disease, so heart disease from birth, as well as overuse of alcohol. So as I mentioned, atrial fibrillation is a condition that people may not even notice that they have. It can be something in which the heart goes into and out of, at times beating regularly and at times beating irregularly without your noticing it. But there are also some symptoms that it may present as. These include feeling the sensation of an irregular or very fast heart rate, having a sensation of palpitations or an uncomfortable feeling in the chest, discomfort in the form of pain or pressure. Sometimes it can cause some shortness of breath, fatigue, dizziness, sweating, or nausea, and in sort of extreme circumstances can even cause some lightheadedness or fainting sometimes. So in terms of making a diagnosis of atrial fibrillation, because it is something that triples the risk of stroke, it's very important to see your doctor if you have any sense that you've had an irregular heartbeat or have concerns about that, or if anyone's told you that your heartbeat is irregular. This is something that can be easily checked in your doctor's office simply by them feeling your pulse and listening to your heart, and then they may order some further tests with an ECG or a 24-hour monitoring test. as well as using an ultrasound, which is an echocardiogram of the heart. There are various treatments for atrial fibrillation, and these are things that you would discuss with your doctor. Some of them, in terms of preventing stroke, involve blood thinners, which help prevent clots from forming in the heart. There are also various medications that can help control the rhythm of the heart, as well as the rate itself to keep it from beating too fast, as well as maintaining a healthy lifestyle is also very important. Just to touch on some of the blood thinners, just so that some of these may be familiar to you, and just so you have a sense of them if it does come up in discussion with your doctor, we'll go through a couple of them. The first one is aspirin or Plavix, and these are antiplatelet agents. Aspirin is something I'm sure all of you have heard of or perhaps used yourself before. It's something that you can buy over the counter. But it is something in the case of atrial fibrillation that will be prescribed by your doctor in a specific dose. It's usually a smaller dose than what you would buy just for treatment of pain or something like that. And if you've had a prior stroke, aspirin can lower your risk of future stroke in the setting of atrial fibrillation by about 20%. Some more powerful blood thinners involve one in particular named warfarin, also called Coumadin, and in the setting of atrial fibrillation in people who've had a prior stroke, it can lower your risk of second stroke by 60%. So its risk reduction is greater, but it does also involve some risk and benefit that needs to be discussed with your doctor prior to you being started on that. And the way that it works is it prevents the blood from clotting. Different than the aspirin or the antiplatelet agents, it actually affects the coagulation cascade that we call it, and where it works is on thrombin, which is part of the overall clotting system in our blood. It acts on vitamin K, and it needs to be monitored in terms of food intake. Some things can affect it, and needs regular monitoring with blood tests. There are some newer different oral anticoagulants that are similar in terms of being comparative to warfarin. The names of these are dabigatran, apixaban, rivaroxaban. They also act to inhibit the blood from clotting. They are not affected by diet in the same way as warfarin, and they don't have the same regular monitoring tests, but they do also have risks and benefits that need to be discussed with your doctor before you would be started on one of these. And certainly an important thing to keep in mind is that all of these blood thinners do carry the risk of bleeding, and this is a decision that you would make with your doctor before being started on any of these for treatment of the atrial fibrillation. Now we'll talk about some of the other risk factors that are important to keep an eye on, one of them being high blood pressure. And so some of you may have heard of this before. It's also referred to as hypertension. Many of you may already be treated for this or know friends and family who are. And what high blood pressure is essentially when we measure your blood pressure, we're measuring the force of the blood moving against the blood vessel walls. There's usually two numbers that are recorded. One of them is called systolic. It's usually a higher number, and it's the pressure that's measured when your heart's contracting. And the diastolic is the lower number that's measured when your heart is relaxing in between the heartbeats. The reason hypertension is important in terms of managing your risk for stroke is because over time, high pressure in the blood vessel walls can cause some scarring to the surface of the blood vessel over which fatty plaque can develop, which is also termed atherosclerosis. And this buildup can cause narrowing or blockages in the arteries. If you remember back to one of the slides that Laura had showed us of the carotid arteries with the narrowing, that was where this plaque had sort of built up. So that's something that we can see with high blood pressure. As well, Laura had also mentioned the bleeding type of stroke or hemorrhagic strokes can also be caused by high blood pressure. So there are various targets for blood pressure in terms of what we consider normal and what's considered high. I've put up this table here just to give you a sense of what these numbers look like. But this is certainly something that your doctor would measure in their office and would give you a sense of what your target should be. And it's something that many of you may already have a home monitoring device. And so it's something that you can keep an eye on yourself. And it's also a good idea to bring your home monitoring device with you when you see your doctor so that you can make sure it's calibrated in the same way that you're getting the same readings as what your doctor might be getting, or at least something close to it. We know that in patients who've had previous stroke, managing our blood pressure will lower your risk of stroke by 30%. So certainly significant and important to take note of. Treatment may involve medications. It's something that you'll have to have followed by your family doctor. Generally, it's monitored over a few visits, and medications may need to be adjusted, as well as various lifestyle recommendations. And we're going to talk about some of those lifestyle changes as well. Cholesterol is one of the other culprits in our risk factors for stroke, and something that we can all work on to improve our risk. And what cholesterol is it's one of the fats in our body, and we produce cholesterol ourselves. It's important in making cell membranes, vitamin D, and other hormones that our body uses. But there's two types of cholesterol, which you may have heard referred to before. One of them is a low-density lipoprotein, or called LDL, and it's sort of thought of as the bad cholesterol. It tends to promote this buildup of plaque that can cause some narrowing in the blood vessels. And the other kind is a high-density lipoprotein, and it's sort of thought of as the good cholesterol because it helps remove this LDL from the artery walls. So cholesterol is measured through a blood test. It's usually a fasting blood test that your doctor would order for you. And then if it is in fact high, they would prescribe either a cholesterol-lowering medication, in addition to some lifestyle adjustments as well. Some of the things we have listed here are some of the guidelines from the Heart and Stroke website that they recommend, but certainly are things you could talk about with your doctor or a nutritionist as well. Aiming to reduce your fat intake to about 20 to 35% of your daily calories, making sure you're choosing healthy fats instead of saturated fats, things like vegetable oils, nuts, and fish, choosing those more often than things like red meat or high-fat dairy, and avoiding some of the trans fats, things that I think you may have heard of. They're usually in baked goods, and these are sort of artificially altered fats. And in patients who've had stroke before, by managing cholesterol, we can lower the risk of stroke by about 20%. Diabetes is one of the other ones we wanted to touch on today. So it is a major risk factor for stroke. We know that when people have persistently high blood sugars, it can cause some damage to the blood vessel walls and also contribute to the buildup of this plaque. You may notice I keep referring to this buildup of the plaque, and all of these sort of risk factors work together in contributing to buildup of plaque in the arteries. So overall, by managing each of these things individually, we can really try to reduce the overall buildup that we get and the atherosclerosis that develops over time. So diabetes itself, there are two types that you may have heard of. Type 1 occurs when the pancreas itself does not produce insulin. Insulin is what our body needs to take up sugar into the cells and to use it. And the type 2 is the sort of more common one we see in sort of throughout the older ages, and it develops when we develop a resistance to that insulin. So your body tissues no longer work as effectively to take up the sugar, and you can end up with a high blood sugar. In terms of diagnosis for this, you can have your blood checked by your doctor. It's usually a fasting blood glucose. There are a couple other ways they can also measure that. One of them is a hemoglobin A1C that your doctor may order. And occasionally your doctor may also need to do an oral glucose tolerance test, which is another way to also check how your body uses sugar. And if you do receive a diagnosis of diabetes, this is something that you'll need to work closely with your doctor to monitor. Your doctor will usually give you some goals as far as the target ranges your blood sugars should be in, and you may need to monitor this regularly with either home glucometer checks or through your doctor with laboratory values. There are some oral medications that can help lower your blood sugar, as well as things like insulin injections, and that would all be determined depending on what your blood sugars are and what your doctor has found on their investigations. So to move on to lifestyle factors, which is something that we can all work on even without having to see our doctor for these things, there are lots of things that we know that can contribute to lowering our risk of stroke. These things include exercise, diet, nutrition, reducing and moderating our alcohol intake, weight management, smoking, and stress. So exercise is important to make as close to daily as you can part of your life. It doesn't have to be high-intensity exercise, running marathons or anything like that in order to make a difference. The Heart and Stroke Foundation recommends that even getting at least 30 minutes most days of the week is going to give you significant benefit in lowering your risk for heart disease and stroke. And things that fall into moderate or activity are walking, gardening, doing activities around your house, even household chores that get you active, get your heart rate up a little bit, can help improve your overall health. In terms of diet and nutrition, I won't go into too much detail in terms of specifics for this. We did touch on some of the recommendations in terms of cholesterol, but overall I would direct you to look at Canada's food guide to make sure that you're getting adequate nutrients in your diet, as well as to make sure that you're using the appropriate portion sizes. That's something certainly in our lifestyle, in our era of convenience and availability of restaurant food, portions are often much larger than what we actually should be getting as our intake. So they have a lot of useful tools to look at how much you should be intaking of each thing to give you a sense of what portion size should be. Moderation is key, and certainly there's lots of resources out there. I've mentioned Canada's food guide, and that's a good starting point, and they have some other resources and links through that as well to find other ways in which you can manage your diet. You can talk to your family doctor and also other support groups to help you with this. In terms of alcohol, we know that overuse of alcohol does increase blood pressure and will contribute to both heart disease and stroke. So it's important to use alcohol in moderation. I know a lot of people have heard that a glass of wine a day can, help with heart disease or things like that, but it's certainly important that we overall keep a sense of moderation in mind. For women, it's recommended that you limit yourself to maximum 2 drinks a day to a total weekly max of 10, and for men, a max of 3 drinks a day with a weekly max of 15. And also keeping in mind that portions are also important in terms of alcohol. And here I've listed a sense of what a single portion or single serving size is. In terms of weight management, we've talked a bit about diet and exercise, and certainly these things are important to help you manage your weight. But weight itself is also a risk factor for developing stroke. So it's important that you are exercising and eating a good diet, but also do take a look at your weight to ensure that you are also, if you do need to lower your weight, that's something that you do pursue. There's guidelines for waist circumference that are suggested for men that you try to aim for being less than 40 inches and for women less than 35 inches. It's thought that the fat that's carried around the belly puts us at higher risk for developing stroke and heart disease and atherosclerosis. So that's why waist circumference is thought to be important there, as well as overall body weight. And there are various tools out there that can help you measure your BMI or body mass index. If you Google something, they'll usually come up with a calculator if you wanted to put something like that in. And the goal is thought to be between about 18.5 to 25. And that tool is useful just because it helps us in terms of using any height or weight to get a sense of just a standard measure there. But certainly talking to your doctor if you have any questions or concerns about what your healthy weight should be. Smoking is one of the big ones, and both Laura and I recommend to everyone that we see in hospital who comes in with stroke that they absolutely need to stop smoking. It's something that we see time and time again, and we know that it certainly does contribute to your risk of stroke. It causes buildup of plaque in the arteries, causes increases in your blood pressure, increase your risks of your blood clotting, and also makes your heart work harder, reducing the amount of oxygen in your blood as well. So it certainly does a lot of things that contribute to developing stroke. And so we strongly encourage everyone to try to quit smoking. By quitting smoking, the positive things about it is that it will immediately reduce your risk of heart attack and stroke. One thing that smoking does, as I mentioned, it decreases the amount of oxygen and the way that your body can heal. So by quitting smoking within a few days, you will have improved your healing time from even simple cuts or having to undergo procedures. This can make a big difference in your health. As well as it's been studied that within a year of quitting, the risk of dying from a smoking-related heart disease is cut in half. So that hugely reduces your risk of heart disease, and we know it also reduces your risk of stroke. So certainly something to consider quitting. And if you do want to quit smoking, there are lots of resources out there. The BC Smoking Cessation Program has lots of useful links. You can talk to your doctor, or you can also look this up online. There are some medications that can help with that, and you can get some counseling around that as well. So certainly worthwhile to try to quit smoking. It's something that's certainly very difficult to do, and we recognize that. So I think a lot of doctors are able to provide some support, and these resources as well can help you with that. So just to conclude, we've gone through quite a bit of information in the last few minutes here. And so to sort of circle back to the beginning, some of the main points we wanted to ensure that you took home with you today was the stroke is a very common disease. It's something that we see all the time, and it includes both the ischemic and the hemorrhagic, the bleeding types of stroke. The symptoms of the stroke depend on what part of the brain has been affected by the stroke and what part the blood supply has been cut off to. It does need to be recognized in a timely manner, and FAST was the acronym that we talked about today, standing for face, arm, speech, and time. Also important to take home that treatment exists. There is TPA, which is our clot buster medication, within the first 4.5 hours. If you're a candidate for this, it's something that we usually like to try to use after a stroke begins. Also that there are some risk factors that we can't change, but there are lots of risk factors that we can. Some of these require being diagnosed by your family doctor or being monitored through your family doctor, and those are things like the atrial fibrillation, hypertension, cholesterol, diabetes. But some of the other things are things that we can change on our own and be working towards day by day, and these are quitting smoking as well as the other lifestyle factors like reducing stress, diet, exercise. There are medications that can be used to lower the risk of stroke in addition to these changes in lifestyle, and those things can be discussed with your doctor. So thank you very much for listening to our talk today. These are a couple of the resources that we used when we were putting together this talk. The Heart and Stroke, the Canadian Heart and Stroke website is actually very informative. They have a lot of great information. And UpToDate.com is a resource that provides some patient information on certain topics within stroke, and so that may also be of use to you. Thank you.